Oke, Say. Kamu pernah gemuk nggak?
Pernah dong.
Sorry ya, ini pertanyaan sensitif untuk ladies. Beratnya berapa?
60 kilo.
60 kilo. Waktu kapan?
Waktu kuliah. Jadi sering ngerjakan tugas malam-malam, tengah malam. Jadi sering pergi sama teman-teman beli roti bakar, jagung bakar. Jam 10-an, 11 keluar nasi goreng, lele bakar, lele goreng. Jadi
lapar nih. Wes udah makanannya cukup. Kamu kok kayaknya bangga ya?
Enggak lah, ini kan memang kenyataan. Tidak ada yang.
Okay. Terus berusaha menguruskan berat badan?
Waktu kuliah kayaknya enggak.
Cuek aja ya.
Cuek aja, enggak peduli lah.
Kalau aku sih kebalikannya ya. Makan banyak tetap aja nggak bisa gemuk.
Enak dong.
Iya, enak bisa makan. Banyak orang tuh gemuk, mau kurusin berat badan, sudah diet, exercise, nggak kurus-kurus, mungkin tambah gemuk.
Iya.
Oke, ini aku ada teman Dr. Goh, mau sharing tentang bagaimana cara menguruskan berat badan, mulai dari pertama yang kayak diet and exercise sampai complicated seperti operasi.
Okay.
Semoga informasi ini berguna bagi mereka yang mau menguruskan berat badan tapi tidak berhasil. Okay, good morning, Dr. Goh.
Good morning, Dr. Tony. My name is Dr. Peter Goh. I was Associate Professor in NUH and NUS, and then Professor of Surgery in Cologne University, and Professor of Surgery in Monash University, and now I am Chief of Surgery in the Yosemite Group in Shanghai, as well as running Advanced Surgical Group in Singapore. Okay, the options are very wide. Of course, the first line is always self-effort, which means diet and exercise. But studies have shown that only 10% of people are effective in using this form of treatment, and there is a high relapse rate. Of course, the next level will be pills, but pills all have side effects and are not fantastic, and you can only take them for about 3 months at a time, then you have to stop, and then you have to wait a while before you can start again. And during this period when you stop the pills, very often you regain some of your weight. The next type of treatment are injectables. So there are now drugs that you can inject yourself. Some of these drugs are injected by gastroscopy into the stomach. Others you inject yourself, that's just like giving yourself insulin. And this can also suppress your appetite, and you can lose maybe 10-15 kilograms using injectables. The next line of treatment, of course, are balloons, and we have many different types. There's one type here called the ellipse, which you can swallow yourself, so it doesn't require any procedure, and then we just take an X-ray to check the position. Others have to be inserted by gastroscopy. This is a 6-month balloon, and this is a 1-year balloon, and you can lose considerable weight with these, but again it's a temporary measure, because after we remove the balloon, or when the balloon passes out, as in this disposable balloon, you can regain the weight again. But this is good for a kickstart to your weight loss program, and losing weight, a considerable amount of weight, say from balloons or injectables, can also reverse some of your medical problems like your diabetes and your high blood pressure. BMI is a good guideline, but it should not be held too strictly, because some people have very high BMI but they are full of muscle, so they are not actually fat, and some people have very low BMI but they have a big belly, and this is all visceral fat, which is very dangerous because it causes chronic diseases like high blood pressure and diabetes. Generally, we are looking at the people with higher BMI to proceed with these procedures, but those with very high BMI probably will not benefit from some of these temporizing measures, but will benefit more from bariatric surgery. I think obesity is defined in Asians as BMI above 27. So anybody with BMI above 27 is okay for this procedure. I think if your BMI above, say, 33, balloons are probably not strong enough to give you the amount of weight loss which you require. and you'd be better off doing bariatric surgical procedure, and these are all done keyhole, like sleeve gastrectomy or gastric bypass. Well, there are two ways. The latest one is you swallow it yourself by just drinking water. You swallow it, and then we blow it up with 550 cc of saline. So this sits in your stomach for about 4 months, and after that it will rupture by itself and you will evacuate it in your stool, so you don't require any procedure at all. The older balloons all require some kind of procedure. We need to put you under sedation and then insert it using gastroscopy, and then we blow it up, and then we pull out the catheter so that nothing sticks out from your mouth, and we leave it there for 6 months, or in this case of this balloon, which is adjustable, for a whole year. After that, we have to remove it again by endoscopy, but there's no surgery. Everything goes through the mouth. Well, one of the greatest problems with balloon procedure is adaptation. So patients can feel very uncomfortable after the balloon insertion, and so they can feel nauseous or may vomit or feel very uncomfortable in the stomach for a few days, and we have to use drugs to suppress these symptoms. But most patients will be able to adapt to it, and some cannot. A small percentage of patients will request that the balloon is removed immediately because they cannot go through the adaptation process. They feel uncomfortable, they feel very full, the stomach gives them cramps, they may have reflux, and some of them actually vomit. I think everybody will have some degree of side effects from the initial insertion. About I think 90 or 95% will be able to get through this period and then adapt, and then they won't feel anything anymore. 5% probably cannot adapt, will have to be removed. Well, one of the advantages of the adjustable balloon, you can start very small, so the number of patients who adapt to it are higher, and then you can inflate it as time goes by over 2 or 3 months to its actual size, so that the adaptation procedure is made much more comfortable. Okay, the amount of weight produced by a balloon is very variable. Some lose maybe 5 kilos, some will lose 10, and some balloons can actually make you lose 20, 25 or more kilograms. So it's actually variable, it's dependent on the person. Well, when they are not successful with the balloon, we usually will remove it, and then they will have to consider other means to lose weight. Either they go on drugs or they go on injectables, or some will give up and say, okay, let's go for surgery, which is more or less a permanent solution to their weight problem. No, you can start at the bottom of the ladder, or you can go straight to the top. You don't have to do it step by step. There is no necessity to go through every step. For some patients, this is the first option. Yeah, because they are very extremely fat. They know they can't make it with any other option, so they go straight and jump into surgery.
Semoga video ini berguna bagi kalian semuanya.
Jangan lupa subscribe, like, dan share video ini.
Terima kasih banyak sudah mendengarkan, dan sampai jumpa di video yang akan datang. Bye bye.
Bye bye.
Bye bye.
Bye bye. Bye bye.